let's talk about Wegovy. How long have we had it? When will it be available in Spain? How does it work? How much weight can you actually lose with Wegovy treatment? How should we use it and in what context? What side effects can it cause? Is there any risk if you have thyroid cancer? All of this and much more in this video. Let's get started. First, let's talk a little bit about history. Let's put things into context. Wegovy is a medication whose active ingredient is semaglutide. That may already sound familiar. Semaglutide is a medication approved in 2017 for the treatment of diabetes. It is marketed under the name Ozempic. With this medication, doctors began to notice that patients were losing weight. And in 2021, thanks to the STEP studies, approval was granted for the treatment of obesity. In 2021, it was approved by the FDA, and in 2022, it was also approved by the European Medicines Agency. So Wegovy is semaglutide, the same medication we have been using for more than 7 years since 2017 for diabetes treatment with excellent results. And now we use it at doses of up to 2.4 milligrams for patients with obesity. This is a medication that since 2023 has been available in the United States. During 2023, it also began to be marketed in Europe, and today we already have it in many European countries. When will it arrive in Spain? Probably during spring or the first months of summer 2024. By then, it should be available in Spain. How does semaglutide work? What semaglutide does is act on certain neurons related to appetite, which affect how much we eat. In other words, they regulate our satiety. They influence whether we eat more or less. What Wegovy does is help you feel full much earlier, so you want to stop eating sooner. As a result, patients eat less. We have also seen that GLP-1 medications have effects on gastric emptying. In other words, the stomach empties more slowly, so food stays in the stomach a little longer, and the patient also feels full earlier through this mechanism as well. We have been using GLP-1 medications for more than 10 or 15 years. They improve glucose levels. They improve inflammation. These medications have an important immunomodulatory and anti-inflammatory role. They have effects on blood pressure and on cardiovascular risk, even in patients who do not lose weight. So these medications also have other very beneficial effects. How effective is Wegovy when it comes to weight loss? If we look at the results from the STEP studies, weight loss achieved with Wegovy 2.4 milligrams is somewhat greater than what we saw with liraglutide 3 mg. To give you an idea, the average weight loss we saw with Saxenda or liraglutide was approximately 5 to 12%. With Wegovy, we will probably be looking at losses of around 10 to 18%. Almost 90% of the patients included in the studies lost more than 5%, around 88%. And 50%, around half of the patients in the studies, lost about 15 to 18% of their weight. But pay attention to this, because this is very encouraging. Around 1/3 of patients lost close to 25% of their body weight. What side effects does Wegovy have? Well, the important thing is that you should not have serious side effects. The side effects are similar to those we see with Saxenda. They are mainly gastrointestinal. Some nausea, some vomiting, some constipation. These effects usually tend to improve and gradually disappear after about 2 months of treatment. That is what the studies tell us. Today, in March 2024, when this video is being recorded, we still do not have it available in Spain. So again, I do not yet have real-world experience with this medication, and I will talk about it later. But there are no serious safety concerns. There is no real risk of gallstones. There is no risk of pancreatitis. And the warning people discussed about thyroid cancer seems to be a risk that is not well documented. There is no strong scientific evidence to support attributing thyroid cancer to patients treated with Wegovy. Now here I really want you to pay close attention. Treating obesity is one thing and adding a medication is another. So Wegovy is going to be a very useful medication and it will help us a great deal. But if we do not use Wegovy as part of obesity treatment, meaning as part of a supervised lifestyle change with dietitians, with psychologists, and with an exercise program, properly prescribed to help us build muscle mass, then the medication alone will lead many patients to regain weight. So we really need to insist on this point. These medications should be prescribed by doctors who are experts in obesity and within the right clinical context. In other words, the patient must truly change their habits. And then on top of that, we add a medication that enhances the effect. That way, we lose more weight and we may even lose it faster. And this is the key point. When we decide to stop the medication, because the downside of these medications is that they are expensive, the patient will maintain the weight loss. The patient will not regain the weight. So I want you to pay attention to this. These medications are not quick fixes. We cannot use them in just any way. It is important to use them properly prescribed and together with a lifestyle change program. Keep that idea in mind. Do not be tempted to use them simply just to lose a few kilos and that's it. Because in the long term, you may get poor results with weight regain. Used properly, they can work very well. Keep that idea in mind. Wegovy is arriving in Spain. We will have it soon and we will talk about it when we have real-world experience. Weight loss of 15 to 20%. Some patients lose even more. A well-tolerated medication. A medication where the dose has to be increased week by week, as we will explain when we have it available. And again, this is a medication that should be prescribed by a doctor who specializes in obesity. And it should be used within a lifestyle change that helps us lose weight properly, so we lose fat and gain muscle. And then do not regain the weight. If you have obesity and want to treat it properly with a multidisciplinary team, with endocrinologists who understand this disease, I encourage you to book an appointment with us. Whether in person or online, we can treat you. Wherever you are, we can help you with your specific needs. You can book online. In the video description, I will leave the Dr. Elia link, as well as our website and phone numbers. I also invite you to subscribe to this channel. It really helps us. If you want us to talk about other topics, leave them in the comments. Follow me. See you in the next videos.